I'm going to skip over a lot of the backgrounds on OCAL because I already presented a bit during the plenary in that. So, but if anybody has any questions about who we are, let me know. So just the one part that I did want to touch on is, again, that clinical experience, how we kind of learn a lot about migrant farm workers based on what we see clinically. So part of our attention to around pesticide safety and pesticide issues was because clinically we started seeing workers present with concerns. So some of it was concerns for pesticides, so that would include stories of people talking about working in the field and seeing something sprayed over here, feeling like it was brought over here and really not knowing what to do, to people presenting with symptoms that they associated to low levels of pesticide exposure. So skin irritations, eye irritations, nausea, headaches, and oftentimes those symptoms would come with work experiences where they felt that pesticides were actually being sprayed around them. So let's say they saw a leaf that had some white powder, they really didn't know what that was, but they worked with it, and then afterwards they had some irritation. So in their mind, it's pesticides, right? So that's what was presenting to us clinically, and so we really wanted to get to know more about what was going on. So we decided to engage with workers in a higher level to directly ask them about their experience with pesticides. So what we did is we basically engaged with them during our clinics and our workshops. So we talked to workers. I explained in the other session I gave around the data collection, where a lot of this, what it looked like was from during our clinics, I would ask a person if I could speak to them about pesticides, and they would say yes or no, and I would kind of take them aside and I would just start talking to them about their concerns. And so a lot of this started really open-ended. With open-ended questions, and as I kind of heard about people's experience with pesticides, certain things would pop up that I'm going to get to. So then I would ask those same questions to more workers around those areas that seem to be of concern. We also, part of our clinic questionnaire, we had already put in a couple questions. So our clinic questionnaire is, if a migrant worker comes to see our doctor or our nurse, they have to fill out a questionnaire that just asks some basic health questions. But we had embedded some questions around hygiene, thanks to a lot of work through our hygienist Murray. So just questions around laundering, around washing clothes, things like that, just to kind of get a sense of, do people have washing machines, do people have access to water? Again, around hygiene, but a lot of that relates to pesticide safety, right? So residues on clothing, if you get residues, somehow being able to wash them off. So we were already working with a little bit of data around people's responses to those things. But again, we felt like it was important to ask them a couple more questions. So again, this, as I mentioned, it began really open-ended, so we were just asking questions, and again, as we started hearing trends, I would ask those questions to really flush out those trends that we were hearing from other workers. Just in terms of, I just included a bit of an insight in this process just for people who might be interested in kind of working with workers and asking questions around like that. Again, we had to explain to people about confidentiality, transparency, what we were using this data for when we were talking to them, and then it was good to kind of balance between open-ended questions and then more pointed questions. So again, when I started seeing those trends, I really wanted to ask about those things. So our main findings. Some workers didn't have any concerns with pesticides, so that was something. A number of workers said no. Everything that happens on my farm, or I don't work close to them, I don't really have concerns with pesticides. But some definitely identified symptoms that they were relating to pesticide exposures. Most of them that spoke to us were low-level exposures, but some of them also knew stories of people where these cases sounded like way more serious situations, where people were vomiting or things like that. Again, a lot of it is hard to really get to the crux of it because a lot of people aren't sharing a lot of information, so we don't necessarily know if that was heat stress or what, because even in OPEP's training guide, we talk about the symptoms. A lot of the symptoms are similar. But again, a lot of people were reporting symptoms that they were associating with low levels, and again, these stories. A big finding that we had is people were very anxious about pesticides. So what they felt is that they were not part of the conversation on farms. They found that farmers, they weren't being told what was being sprayed, if they should be protecting themselves. They just kind of weren't part of it, and that really caused them a lot of anxiety because they know that something's being sprayed, but they're not sure what it is or if they should be protecting themselves about it. And that's kind of a tension because in the presentation you saw, a lot of the system is organized around if you're not dealing with pesticides, and if you're following the regulations, the no entry interval, so when something's sprayed, there's a certain amount of time that, as I'm going to get into, Health Canada says don't enter that field. So the system's set up to say, you know, if you're following the rules, you shouldn't worry. So a lot of times what we find is that farmers might not be communicating these things to people because the field worker is not really seen as in the middle of a risk or a hazard, right? And then we did get some feedback from people that they had not received training. And a few of the people that we had respond, and similar to Rowan's comment, were involved in mixing and spraying roles. And so we tried to get really into the crux of that, whether they didn't receive training or they didn't understand the training, whether the training was in English. So we still had to really kind of get that, but some people did let us know that was the case. And there's a lot of worry about pesticide drift. That was kind of a big thing that came up repeatedly. So again, people would be working in a field, something would be sprayed down the way, the wind would blow it, it would land on them, and they wouldn't know what to do, whether they should stop, run, go wash themselves off, or continue working. And again, that connected with the anxiety, because some people would continue working, and for a chunk of their day, they would be working there thinking, crap, like, did I just get some pesticide sprayed on me? Again, the issue in terms of a big theme around this is the communication component, because those workers didn't necessarily know if that was actually pesticide. That could have been irrigation water, right? But because they're not being part of the conversation of what's being sprayed, when is it being sprayed, that anxiety is very real to them, right? And then if they get these symptoms that could also be an allergy, could be a dermal irritation from something else, it all becomes something, and it's hard to tell really what's going on. But definitely other people did very clearly talk about drift, that they really could smell it, they could taste it. So in those situations, it was more clearly pesticides. Another finding, some more findings just quickly. Most workers had functioning washing machines. So as a lot of you know, migrant farm workers live on the property of their employers, and often the housing is organized by employers. But we found is in a lot of places they would have a few washing machines for a very large number of people. And some of them, again, those hygiene questions were so important in our clinic questionnaire. We found that a lot of people did have control over when they could wash their clothes, but there was a long waiting list. So if you're in a bunkhouse of 25 guys, your clothes washing is not going to be maybe at the level that you'd like it to, because you're waiting to use those machines. Some workers did not have access to hand washing resources on their farm, so we asked, if something happened on your farm, could you run and go rinse off somewhere in an immediate location? Some people said they couldn't. And a lot of people were really curious about the use of PPE, which is personal protective equipment. So gloves, masks, goggles. And yeah, Lynn is holding up gloves too. And so a lot of times with PPE discussions, we're again talking about the mixers, the loaders, and the sprayers, but there hasn't been a lot of attention around if you're a field worker and you do, for example, get an irritation that you're associating with pesticide, should you be wearing gloves? Is that something that we should be considering? Should somebody be suggesting that? A lot of that communication is not reaching workers. There's not really a clear message to say yes or no, because again, as I'm going to kind of touch on, the idea is that if field workers are entering the field after that no reentry interval, those residues should be at levels where they're not toxic to them. But if we're seeing symptoms, and this is where kind of the reporting comes into, if we're seeing symptoms that are associated with pesticides, then that kind of triggers understanding maybe those intervals are not long enough, right? Maybe those are things that are happening that we need to kind of better understand. So that was a big thing around PPE. And intimidation of reporting. So we talk about these mechanisms of reporting, but a lot of people did not. I don't think I talked to one person who either knew how to report if they were concerned about pesticide, and most of them felt like if I asked, would you be comfortable if I gave you the number, which I'm going to show you kind of Health Canada's reporting document that they hand out, would you do this? And the majority said that in their idea of their work and things like that, they would feel quite intimidated to report. So contextualizing this into a bit of around Health Canada, and Lynn touched a bit about this, but so Health Canada PMRA is the agency at the federal level that, as Lynn touched on, looks at these substances, regulates them. So they, as Lynn touched on, they determine whether the product is acceptable, the risk is acceptable to human health and the environment, I guess, yeah. And they also set the maximum residue limits of a product, so they can say how much of it can be a residue on that crop, etc. And they set their no reentry intervals. So they study to what point you have to wait until somebody can kind of touch that crop or engage with that residue. And they also are the ones that collect the incident reports. So an incident report is if you're working on a farm and you're worried about pesticide safety and you develop, let's say, a cough, a headache, like any health effect that you think is related to pesticides, that's an incident report. So Health Canada collects those and then uses those to reassess products. So the idea of that system is that if they suddenly get a lot of calls to say, you know, I'm using this product and I'm getting a whole bunch of these health issues, then they can say, okay, look, wow, something's wrong. We need to really reassess that product, see whether we need to change the label and give better instructions, whether we need to use more PPE, whether people need to stay away from it as longer, or maybe it shouldn't be used, maybe it's too toxic, et cetera, right? That's the idea of that circular incident reporting system. And I'm going to get to kind of the problem with part of that, but then the other context is the education context, which is OPEP, that, as Lynn explained, they look at the certification and the course and the education to really have people do things safely and adequately so they can protect themselves. So our main findings around kind of that context was that the regulatory system really focuses on mixers, loaders, and sprayers. So a lot of the attention is really important because those are the people who are really obviously coming into the most contact with these substances. But again, the field worker, that question about the field worker is really left out around a lot of things. We also, and this is kind of written wrong, but yes, previous to our connection with OPEP, there wasn't Spanish-speaking assistants, Spanish-speaking trainers to offer Spanish training. So what I think was happening was that some trainers were providing the training with translations, or translators, sorry. So I'm going to get to how OPEP really took the initiative to approach us and really say, okay, this is a gap, like, can you help us out with this? Then another assumption is, again, that if people abide by the no re-entry interval, so if people wait until they're told not to enter the field, they should be okay. So again, you know, if you're following the rules, you should be okay is a theme that seems to be really in the system. And there's really a limited recognition of the barriers faced by migrant workers to report incidents. So the system's not really picking up on how to make it a reality to actually get those on-the-ground reporting actually happening so that PMRA Health Canada can really know what's going on. And yeah, like I said out in a presentation from Health Canada PMRA where they said that they really hadn't gotten incident reports from the farming industry. And they were kind of talking about more neighbors to farms putting reports, but when I talked to the person, which a lot of us that have worked with migrant workers, you know, our antennas go up because we've heard so many stories. So obviously the reporting system is not capturing things, right? If we're hearing this and researchers are hearing this and things like that, but I don't know. So, and what really stems into this as well is that, and this is kind of this forum's connection to kind of very health and safety issues, but also healthcare issues, is that these workers have limited access to primary health care. So oftentimes, you know, they're already not receiving attention from the medical system, so they don't, you know, these symptoms are not necessarily being addressed. They don't have that connection to a doctor who might be able to sort some of these things out. At the same time, health providers also, what we're finding in rural towns is that their training is not so much geared towards a lot of occupational health issues, and specifically not really geared towards a lot of chemical things. So we had encountered situations where physicians or nurses were treating symptoms as separate symptoms, so a headache, a nausea, but they weren't really asking those questions like, what's your work like? What are you doing? To be able to see, well, maybe this cluster of symptoms is actually a low-level pesticide exposure. That kind of training for physicians or that kind of background we're finding that in a lot of places, there's great doctors out there, but in a lot of places that skill set or that information is lacking. So intervention, so what we've been really trying to do. So again, really, we're OPEP's biggest fans now in OCAL because really we were at a convention and OPEP approached us and was, you know, really talked about the Spanish training and then trying to see, you know, knowing that we work with translators in different communities. So working with them, we were able to bring Spanish speakers from the main farming communities in Ontario to take OPEP's on the farm training. There's a couple people in the room that are Spanish trainers. And so they took the training and now they can offer that training to migrant farm workers in Spanish. So again, you know, I think it's 5 or it might be 6 now. 5? Okay, 5. We're going for 6, yeah. So again, the number is still small, but the precedent is there and we're really, you know, so if you all know people, let us know. And I think another thing that we all should draw attention to is that people from the Caribbean community, you know, nothing obviously is is not only Spanish, that could be, you know, a great asset, I think, to a repertoire of trainers, to also have people who kind of, you know, are coming at it from a cultural understanding from the Caribbean as well. I think that would be a great asset to education too. But that's something that we've done, and we're also in the process of OPEP and to develop a field worker training. So the idea is that field workers, even if they're not spraying, mixing, or loading, they should have a basic training to just know in emergency to stay away from the pesticides, you know, what the symptoms look like, you know, the red flags. And so OPEP is developing that, and we're working with them for that. And the idea, we just filed for some funding through the Ministry of Labor to have that, to be able to kind of really finish that training. We're going to do it anyways, even if we don't get that funding. We're going to do it anyways, but then to roll out in Ontario that basic training. So I'm just going to skip because I think I don't have a lot of time, but especially for health people in the room. Oh, somebody's trying to get Skype. I didn't know that was going to happen. Well, I think they're from Vancouver, but they were coming to the next session. But the last thing, what we do really want to kind of approach PMRA with is to really have a strategy from Health Canada to really understand the experience of field workers and migrant workers in general around pesticides. So we really want them to do an evaluation of how the current system is actually working with workers, right? So again, this is kind of the form that PMRA Canada distributes around pesticide incidents. So this form is only available, this form is available in English, Thai, Spanish, and Filipino Tagalog. But the phone number to call to actually put a complaint is only in English and in French. Again, abiding by this bilingual kind of federal level administration. And also if there's an internet component of it that you can also do, but again, it's not available in other languages, and we know a lot of migrant farm workers are not. In one session we talked about people using the internet more, but largely a lot of people are not as computer literate as to be able to maybe fill out a form. So we're really working to kind of not challenge, I guess, but really work with PMRA to really respond to those. And also around this PPE thing, to really get some answers to see whether field workers should be giving suggestions, should be talking to field workers about gloves, about masks, about things like that, especially if we're seeing symptoms. So around that whole thing, I guess what we find, and another great thing that we did with OPEP is we translated a series of their a series of educational posters. So now those are available, and those are in Spanish, and the posters are really great. And as Lynn showed, the workbook is really, really great. It's visual, OPEP is amazing in terms of education. Like they know it down on how to engage with people. So it's very great resources. The last thing I really wanted to get to, we did an poster evaluation for PMRA to get an idea of how workers were understanding current pesticide safety materials. And so we did kind of a spin the wheel. This is a poster that PMRA has released, and it's really across the board wasn't very well understood. So PMRA was very open to say, please send us your feedback, what workers are saying about their understanding around the poster, and they want to change it, they want to improve it. So that's a great thing. Now the last thing is clinicians' roles in this. So in the US, what we find is in a series of states in the US, it's actually by law required that if a physician sees a patient that has pesticide exposure, they have to report it. So that's by law. And so this link, I don't know if I'm going to open it, we'll see if it opens. But so this group called the Migrant Clinicians Network created a map of the US where you can click on it and see if your state it's by law. And it's really getting physicians to know if they by law need to, because a lot of them will be in a state where they need that the law says it, but they actually don't know. So the Migrant Clinician Network in the US is really helping physicians know that role, and they're providing textbooks and information so that physicians can know what pesticide exposure looks like. They can so this is the interactive map, so you can click on a state and it'll tell you required to report no. So in that state, you're not required, but
try California or something.
Yeah, that's true. Yeah, or like Texas, probably. I'm hoping. Yes, so required to report, yes. So Texas physicians are required to report. And so that's really what we want to get into with PMRA as well. So for example, this book is from EPA in the States, and it's for clinicians to look through it. It's a textbook to really understand what pesticide exposure looks like, what they should do, to really empower physicians to kind of know. So if somebody comes in their door, they can kind of know. And this would not only be beneficial for migrant workers, but for all farmers. Like, so even when we were attending, I'm going to stop in 2 seconds, but when we attended OPEP's annual meeting with their trainers, a lot of the trainers talked about, and Health Canada talked about saying, some farmers, we're worried that the sprayers, the farmers are still not wearing that PPE. Like, how can we better communicate? And so these are Canadian farmers, and so through the work that OPEP does and what we're trying to do, it's not only going to benefit migrant workers, but anybody working with these substances, and that's kind of, I think, the goal of everybody really involved. It's just a matter of collaborating, seeing whose skill set is what, and so that's why we're really excited to work with OPEP, because our skill set matching with the great educational resources that OPEP has, we think we can do a lot. Obviously, the downfall is that if it's not policy, it's left to the choice of people. So we're really hoping, for example, to push this training for all workers, not just sprayers, to eventually be a mandatory training, right? And that's where the U.S. has gone. In the U.S., everybody has to get a basic pesticide safety training, and that's mandatory. And so, yeah. Any questions, or I don't know?
Yes, there's another 3 or 4 minutes for questions, or we've got the stopwatch running.
Sure.
With the duty to report, I guess, from the physicians in the States, is there an opportunity from just an outreach side here in Ontario to provide the reporting tools, like in CHCs and clinics and such? Because is that incident report available to give to them if they see the symptoms?
Yeah, we've actually given, so I think we've given this to Quest and Grand River CHCs. We've given this textbook to them, and we've given them some resources. But it's the reporting thing with the clinicians, and I wanted to touch on it. It's tricky because also the worker, and we know that workers have fear to lose their jobs. So I think there's a lot of discussion that has to happen, and I'm really interested in talking to people about the U.S. in those states where it's mandatory by law, how they negotiate that. Because if a physician takes it upon himself to report, what does that mean for the worker's job? If that worker is traced back, what happens there? Where's kind of that relationship? So I think in moving ahead around clinicians' roles, that's a component that we need to keep at the forefront, is how are workers, how are we ensuring that if the system is reporting that workers don't lose their jobs. But I think, yeah, like we've started to do a lot of that, but we can do it, but we'd really like Health Canada to get involved and to say, and in the States, I plugged into a webinar that they give, the migrant clinicians give for physicians, and across the US, these physicians just go onto this webinar, hear about pesticides. That's not, that would not be that hard for us and we could actually tune into those, but again, we want to have it be kind of Canadian-based to make sure that things are to our standards, to our regulations. But that wouldn't be, I don't think too difficult in terms of looking at those things.
So just to end on, just further what you have said, that how beneficial it could have been for the workers themselves to get some of those formal training, or even just education around it. Like, education is empowerment for anyone. So for them to get that kind of a training would be wonderful. Especially, when you live on a farm, it's like your little backyard garden. So what if they were working on a different site and they're making supper, and they came home and just need some tomatoes or something? And I don't know, is there a sign that should be posted on the greenhouses or that area that has just been sprayed to say, just been sprayed, stay away for a day? Because, I'm just thinking they might just walk on and grab some fruits or vegetables, not knowing that it was just sprayed.
They should be posting. It's on the label, they need to do it.
But if it's not in the label, there's no legal requirement to post. But I think with our training, we can come up with a sign and encourage that as a best practice, even though it's maybe not a legal thing to do. So that's where we got to reach out to the farm workers and the managers and farm owners and say, here's a sign, we've got a whole bunch of them printed here for you. Here, take 10 of our signs, they're free, and use them. And so we'll get some of those items developed as we work together, collaborate with OCAL, and then get that message out. So we make it easy for the farmer to do some of these things, right?
And just kind of framing it as like, with these substances, if everybody's educated, if everybody's safe, it just is better, you know, because somebody could wander over here, they might not be spraying, but they could wander over here, and you know, these substances are around, so.
Well, I met a guy, well, in my second movie, a guy was applying pesticide without certification. And then the pesticide came to his body. And the farmer didn't let him go to take a shower. So after 1 year, he died. So the wife is in Mexico without money, so the insurance didn't give the money because he doesn't have enough years to get the compensation or whatever. So how can we face that, you know? There's regulations, there's law, you know, articles, acts, but in the real life, it's different, you know? It's,
Back to,
you know,
letting the boss know, and the boss does something about it, and back to that education. Like, it shouldn't be happening. It's illegal, right? It's illegal. So Ministry of Labor can come in and fine, PMRA can come in and fine, Ontario Pesticides Act, they could charge, charges can be laid. It's just a knowledge. If that happened, then how do we get that knowledge from that worker to all the rest of us? Right? Was he silent? Was he told to be silent by his boss? Was he scared of being fired if he spoke up? All those things. And then, even when you learn about it, then how are you passing that along to the rest of us? Because there should be action taken, right? So there's lots of things in place, right? So we need to know, right? And then everyone else can take an action, right? Because it's wrong, it's illegal.
Well, I do train in Spanish, and what I don't think is right for some farmers that I met is like, because the book is in Spanish, and they think they speak Spanish, they pass the books to all the workers that are gonna buy pesticide, and they keep speaking English or very broken Spanish, and that's the training. And I just told Eduardo, for me that's a conflict of interest. Because the farmer will tell them what he can tell and what he wants to tell them. When I took the initial training, I was scared. Because you're right, they don't know, they just, I've seen workers smoking and eating.
no.
And if I want to scare you, sorry, but I have to, because you're using something that is very dangerous, I have to scare you in Spanish. Sorry, yeah, because some of them are not aware that they can die so fast, like in a year or maybe there. So I think it's important that the farmer, he can't speak Spanish properly, he can't provide training to those workers. And the field workers, yes, those guys are clueless.
That's why the Spanish training is so important, because even thinking that somebody's using a translator, you don't know. Like this is such vital information, and these used improperly, these are really given. And just really quickly, I think again, like the onus on there's a lot like when I attended OPEP's kind of meeting, there was a lot of talk about how a lot of these things are normalized even among the farmers. So like the I've done this for so long like this, and so. Also, in working around this, we need to also look at the employers that might also be normalizing these things. So they're not worried about it, so they're not going to be worried about it for these workers. But then their families are worried about them too. So, the whole thing needs to be looked at. And of course, working with the most vulnerable, the most people who are disenfranchised from the system, but I think it has ramifications.